Orderly exchange, shaping policy, advancing development.
In case you're wondering where is Blessing this morning, let me unveil her immediately. Blessing, how are you today?
I'm very really. Good morning, Femi.
How are you doing?
I'm great.
TGIF.
Oh yes,
You look it.
right.
You look
Yes,
it.
I need to look it.
Yeah, it's obvious.
For every Friday, you just need to look and act the parts because you've seen the weekend already, and it's like, yay, weekend is here.
I felt like saying, oh shit.
I'll be you. Oh, I'm best calling.
Thank
you so much for joining us in continuation of what we've been doing over the past days, taking a look at sectors of the Nigerian economy under President Bola Tinubu as he commemorates 1 year in office. Today, we're turning attention to the health sector under President Tinubu. And joining us to review the health sector in the past 1 year is Dr. Douglas Emeka Okor, who is a consultant neurosurgeon. Thank you so much for joining us this morning.
Thank you very much, Femi and Blessing as well, and SOUQ News for having me. I hope you guys can actually hear me well. Sorry, I couldn't get my earphone to work.
Thank you. All right, let's take a look at the health sector in the last 1 year. What are some of the changes or developments that have happened over the past 1 year?
I think basically the key happening was on the 2023, the Universal Health Coverage Day, where the president and his two lieutenants, Professor Ali Pate and also Tunji Alausa, the Minister for Health and Social Care, and also the Minister for State for Health, where they actually launched this Nigerian health sector renewal investment initiative program. And that was an absolutely fantastic day. It's one of the first times that I've seen where you actually have a president, okay, being involved in such a launching, and all the key partners in terms of development partners like Bill Gates and Melinda Gates Foundation, the Dangote Foundation, all being pulled together, and them actually signing a compact with all the stakeholders, including the subnationals, i.e. the state governors in attendance, and also the traditional rulers and key stakeholders like the religious leaders. That was absolutely fantastic in terms of laying a foundation of where we want to go in healthcare in Nigeria. Healthcare in Nigeria has struggled for a very long time, and it was really nice to actually see them actually taking that step and actually laying that foundation for us to actually push through. One of the key things, or one of the key strategies in that launching that they talked about was actually the sector-wide approach, which basically means trying to really integrate the strategies of how they can actually push healthcare. And I listened to I read one of the articles where the Minister of Health himself, Professor Ali Pate, just in a couple of days ago, was in the World Health Assembly, and he was talking about trying to sort of rebuild the Nigerian healthcare system with three strategies, basically. Number one, to try and improve domestic financing of healthcare. Number two, to really try and push and expand primary healthcare. And then number three, try and revitalize and build the capacity of public healthcare. Okay. Now, the question might be, after such launching of a platform, how have they fared so far? I won't lie to you, Blessing, it's a little bit difficult to say, okay, because one of the things I keep seeing are pronouncements, statements, okay? That's one of the things that I keep seeing, okay? I think there's a gap in terms of strategic communication of what they are doing, how they are doing it, giving us that data, okay, of how they're actually pushing things through.
I'm glad you have you join us once again. Let's look at in the last 1 year. You talked about some of these beautiful plans. Now, you also talked about the initiative that was supposed to be geared towards improving primary health care in Nigeria. I would like you to do an assessment of the state of primary health care in Nigeria compared to the vigor and the strength in launching this strategy. What will you think has been the output or the impact of this in the last 1 year as regards primary health care in Nigeria?
I think, Femi, the first thing I would say that, like I said before, the Nigerian healthcare system has been very weak for a long time, okay? And when you talk of the investment and the push and the power that you actually need for the primary health, to actually push and bring out the primary healthcare system that is worth its salt. That has not been there for a very, very long time. So what am I trying to say, Femi? That to push to get to the point where we have a primary healthcare system that delivers on its promise of basic quality, okay, and safety, and the kind of care that we all want at the primary care level is going to take some time. What am I trying to say? It's going to be a marathon and not a sprint, okay? So if this program was launched basically, what, 6 months ago, 5-6 months ago, okay, I'm not expecting to see any big changes in terms of the quality of care, in terms of the indices, like the maternal mortality, child under 5 mortality. I'm not expecting to see any big changes now, okay? But what I'm expecting to see is that sort of strategy, that sort of data coming out, that sort of movement in terms of all the key stakeholders. You can see the movement and the work being done, okay? It's possible, Femi, that the work is actually being done, but because there's that gap in communication with all the relevant stakeholders, with you guys as the fourth estate of the realm, okay, with all the key players, the Nigerian citizens, the professional health associations and bodies, other stakeholders like faith-based organizations, that communication is not consistent. Okay, I keep giving kudos to someone like Chikwe Ihehiazu, who was the DG of the Nigerian Center for Disease Control during the COVID pandemic. You could see that pushing out of information and constantly keeping us updated with what's happening. Now, it is possible, because like I said, that launching was absolutely fantastic, but it's a template, okay? And one of the things I keep saying is that the devil is in the detail. What is the chunk that is actually missing here, Femi, is that detail of what they're actually doing. Like I said, there are many pronouncements, okay? We can go through some of the pronouncements. Okay, they say they want to actually really work on 8,800 of the primary healthcare centers. The data is not really sufficient. Now and again, we hear that we will have about 24,000 primary healthcare centers. Somebody else says about 37,000. But at least the one that is the data that is actually seems to be across board is that at least we have at least 8,800 functioning ones. At least we have like 9,000 wards in the 774 local governments. Okay, that's one of the things that they've talked about. Oh, they want to really revamp these 8,800, and they want to push over the next 3 to 4 years to actually expand that to double that to about 17,000. Okay, what is the data that is actually coming out from the different local governments in terms of this primary healthcare center? Not much is coming out, so it's difficult to actually track these things. I suspect that if you go into the communities and actually talk to the people and say, oh, have things changed in reality in terms of when you access these primary healthcare centers, in terms of the manpower, in terms of things like light, water in the place, in terms of having that sort of good environment to actually access your care? Have things actually changed in these 6 months? I suspect very strongly, Femi, that you're going to get the negative, that things have not changed, okay? But is 6 months enough to actually be able to actually make that mark? Probably not, but 6 months is enough to actually strategically communicate with all of us, all the key players within the system, to say, oh, at least this is what we are doing. I know that they talked about deploying 25 billion of what we call the Basic Healthcare Provision Fund, which is some sort of a part of the sort of 125 billion that we're supposed to have for the year from the budget. Okay, how that money is being disbursed and stuff like, we need that feedback. Also, we know that they've launched this Nigerian health sector fellowship, health program fellowship, where you're going to actually have roughly like 774 individuals who are going to be trained and who are going to actually be doing things like looking at the primary health care development and also performance, and actually feeding back to the Ministry of Health to see how these primary healthcare centers, how they are doing and all that. So those are some of the things that, in terms of the launch, they talk about, but that feedback mechanism in terms of that strategic communication of, oh, how are these things being deployed in real time and how is it impacting on the people? We are not getting that feedback yet.
Let's take a look at remuneration for health workers. With the exodus of health workers to other places looking for greener pastures, has that improved over the last 1 year?
Not really. Of course, when you look at all the issues within the economy, of all the policies that this government has actually made, that's really made life really tough for the people. the number of people who are actually leaving the country and going out of the country has definitely increased. I might not have the data to give you now, but definitely it has increased because it's a big struggle in terms of people actually surviving within the Nigerian economy at this particular point in time. Has remuneration increased within? Absolutely not. I know presently that you still have the Nigerian Labour Congress, the TUC, and the likes actually still having these discussions about either a minimum wage or a living wage and stuff. So not much has increased in terms of the remuneration of healthcare providers or the healthcare workforce. We still wait to see what's going to happen with that. Okay, so the combination of the fact that things have not changed with respect to the remuneration and the fact that things are really difficult across board when you talk about the general inflation, food inflation, and all that, it is a struggle, and you definitely have more people who are living at this particular point in time, looking at health workers.
All right, still on the what is popularly known as the Japa syndrome, which actually is one of the things that shaped the health sector in the last 1 year. In fact, statistics has it that in the last 5 years, over 5,000 doctors have migrated to the UK, and the popular places UK, Canada, and Saudi Arabia. And interestingly, you're in the UK. I would like you to talk to us about this development and how you perceive the Nigerian government to be handling this development here. Do you think the Nigerian government is taking it with a sense of seriousness? And what will have been the approach as someone who is in the other clime in the UK? What would be your recommendation in this regard?
Okay, so just to correct one thing, Femi, I'm actually in Abuja, Nigeria. I was trained in the UK as a neurosurgeon, and I'm actually back in Nigeria. But I also still live in the UK. My family lives in the UK. But yes, so I can tell you the difference between the two and tell you what things look like. 5,000 people in the last couple of years, absolutely, in the last 5 years. Why not? Human beings will naturally vote with their feet. Every human being wants to go to a place or be in a place where they are properly paid, where they have an environment where they can work effectively. Everybody likes a situation where their kids go to the good schools, they have good food, they live in very good housing, they drive good cars and stuff like that. So they will vote with their foot. Has the government done enough on the ground in Nigeria to try and keep Nigerian healthcare workers on the ground? Okay, in terms of strategy, in terms of talking, in terms of proposals, all those are there. But in terms of the implementation of trying to actually improve the environment where healthcare workers work in, not much is happening at the moment. Okay, we wait to see. Like I said, for example, you have the trade organizations, the labor organizations, stuff, having these discussions with the government about how they can actually improve remuneration for everybody across board. But of course, specifically when you look at the Japa syndrome and the people who are actually the professionals who are leaving the shores of Nigeria to other countries, the healthcare workforce is, they are more when you compare in terms of percentage compared maybe with engineers, lawyers, and all that. And so that means that the healthcare workforce, you need to actually have a special strategy dedicated to actually planning on how to actually keep the healthcare workforce, Nigerian healthcare workforce in the country. Okay, are we actually seeing the work done in terms of the true doing things on ground in reality to actually make that happen? We are not seeing much. Like I said, I'm based in Abuja, despite the fact that I was trained in the UK. So I'm a British citizen. My family is in the UK. I am actually based in Abuja. Okay, I'm one of the consultant neurosurgeons in Federal Medical Center, and I am saying that there's no significant change at this particular point in time in terms of that strategy to actually try and keep Nigerian healthcare workers on the ground in Nigeria. And you still have, especially the young people, you still have lots of young Nigerians and even specialists, because people who are fully trained and stuff there, actually still living in the country. So there is lots of work to still be done.
During the COVID-19 pandemic, some intervention was done by the government to support the healthcare sector, particularly in the production of vaccines and research towards that. But now the COVID-19 pandemic era is over, but we have a situation where the cost of medication has increased by, in some cases, over 100%. In that area, there be some intervention to help producers of medication or drugs in Nigeria, particularly as many people who want to access healthcare still do out-of-pocket payments?
Okay, so this health sector renewal initiative investments that they launched, it had 4 pillars. The first one was governance. Second one was about you are pushing healthcare services, and you have lots of things under that. And then you had the one about health securities in terms of trying to prevent outbreaks and deal with outbreaks. And of course, the fourth one was unlocking the healthcare value chain, and that's where what you're talking about in terms of actually creating that environment and actually pushing for investments within the Nigerian space, pulling in organizations who actually come on the ground in Nigeria to actually start manufacturing, build the economy, and actually improve employment. Again, there are strategies that have been talked about that have been launched. Okay, so for example, the Afrexim Bank has actually put down this $1 billion for people, especially the private sector, who are interested in actually trying to push the value chain in terms of vaccine production, medications production, and all that. Okay, again, it is still at the level of strategy. In terms of that feedback to us as citizens and to all the key stakeholders of how far are we going with that, we are still not getting much information. Much of it is about talk, we will do this, this is on ground. But in terms of the impact, it's possible that it's still too short. We're just 6 months, okay? But even if things have not rolled out or things are still in the planning stage and stuff, we still need some information about where we are. And that's, again, I will urge the Federal Ministry of Health and Professor Ali Pate and Tunji Alausa to really probably work with the Ministry of Digital Economy to actually start getting these platforms to really start pushing out this information, okay? Healthcare is so important that we all need to pull together to actually work on it. And part of actually pulling us together is to actually, like I said, provide those platforms for pushing out information. We need to know what is happening. Nigeria is a very large country, 774 local governments, tending almost to at least 10,000 wards. We need information of what's happening in different areas, okay? Clearly, when you look at the issues of all the policies that this administration have put in place, the issues of the general inflation, food inflation, the problem with forex and stuff like that, because we do not presently produce all these medicines, vaccines and stuff in Nigeria, they are going to be sky high. You're having almost 200% increase in the prices of antibiotics, inhalers, and most of the basic drugs that people will take. And it is a very big struggle, blessing, very big struggle.
All right, let's quickly talk about health insurance, which is very crucial in that sector. It's on record that over 90% Nigerians do not have access to health insurance, unlike the other client like UK. Now, most Nigerians pay out of pocket to be able to access health care. How do we address this in Nigeria?
Okay, again, lots of good white papers, lots of legislations. For example, we have the National Health Insurance Agency Act of 2022. Most of the states now have their own state health insurance schemes and stuff. Again, it's about strategy and actually having that sort of data to actually work with. That's why it's really painful that we've still not had the Nigerian Population Commission actually conduct the census. Okay, we need that proper data to know to actually strategize and categorize people. Okay, the people in the formal sector, the people in the informal sector and stuff. And that is the way you can actually pool people and actually be able to say, okay, we have the data of everybody, and then these are the people who are on the National Health Insurance scheme, National Health Insurance Agency scheme. These are the people who are in the state insurance scheme, because we don't want duplication of functions. One of the key things we want is a situation where, just like they signed the compact of the sector-wide approach, where everybody's actually pulling resources together. We want, in terms of the implementation of a social health insurance scheme, either at the national or state level, we want that sort of integration. We want things to be seamless. We don't want a situation where someone in your village is on a social health state insurance scheme and is also on the national health insurance scheme. We need that coordination. Okay, that's why the national and the states need to actually work together. Okay, one of the key things I want to see, we want to see state governments getting serious. I know now and again we keep actually pointing at the national government. Oh, what is Tinubu's strategy for healthcare? Or how has it done in 1 year? What is the agenda for healthcare? That agenda for healthcare at the national level, at the federal level, must be integrated with the strategies for healthcare at the state levels. The state governors are not doing well, Femi. They are not doing well. And we need all, for example, I'm sure we have what they call it, media outlets at the states. They need to start holding and asking their state governments and governors and actually asking them, this health sector reform renewal program and stuff like that you guys are keyed into, where are you with it? Because the problem is this: you will see a state government saying, "Oh, we are going to revitalize so and so primary healthcare centers." But guess what, Femi? It is the same primary healthcare centers that the national government are wanting to revitalize as well. So we don't want to waste funds. We want a situation where they are working together, where there's cooperation, collaboration, and partnerships, and things are seamless. So presently, the National Health Insurance Agency scheme, the state health insurance, the pool and the traction is not great at all. Okay, again, it's 1 year, and it's 1 year of this administration. It's 6 months since the launching. We might say it maybe is a little bit too short, but we want to get data. We want to get information of how the Ministry of Health, of how the State Ministry of Health, how they are working together, and how they're actually improving these numbers in terms of the National Health Insurance Scheme, in terms of how many primary healthcare centers are actually working, are actually fit for purpose. We need that data, and that data needs to start coming out.
All right, before we wrap up on this, what are the things you would need to see at the national level in terms of equipment and facilities to provide adequate healthcare? You work at the Abuja National Hospital, and there's teaching hospitals in various parts of the country. What upgrade would you see that will make you fully believe that indeed there isn't a disconnect between the policies and implementation of the health sector reform?
Okay, so first of all, Blessing, I work in the Federal Medical Center, Abuja. It's actually different from National Hospital. there are 3 tertiary hospitals in Abuja. So the Federal Medical Center, Abuja, National Hospital, and also the Abuja Teaching Hospital in Gwagwalada. I am in an FMC. So again, pronouncements. Okay, some pronouncements have been made that about 16 of the tertiary hospitals in Nigeria are going to be equipped with things like oncology services, radio diagnostics, big imaging equipment and stuff like that. Okay, those pronouncements have been made, and this is supposed to be done by the Federal Ministry of Health in collaboration with the National Sovereign Investment Authority, NSIA. Remember that, for example, in Lagos University Teaching Hospital, you have the collaboration between the NSIA and LUTH that has the oncology services with all the radiotherapy and all that. So they are trying to actually push that out to about 16. So about 16 of the teaching hospitals around the country, and they've given a time frame of 12 to 18 months. So I guess, Blessing, we will just have to wait. This was pronounced in February this year, 2024. So I guess we'll have to wait till February next year, or probably till about July, August next year, to actually see how much of this work has been completed and stuff like that. But one of the key things I want to see is not just pronouncements, not just launchings. Okay, we want to see work on the ground, and we want to see work that is followed by giving us information. We need data. Like I said, I want to see the Federal Ministry of Health working very closely with the Ministry of Digital Economy. We want those platforms that are pushing out information, in such a way that all of us can actually grasp the information and know exactly where we are, because we all want to key in, and we all want to key in, Blessing and Femi, because the Nigerian patients are worth it. One of the things I always say is that the Nigerian patients are worth it. They are worth good care. But kudos to Professor Ali Pate and Tunji Alausa. They are doing a good job in terms of trying to push through. It is difficult in a setting like Nigeria. Like I said, we've struggled with healthcare for the last 40 years. Okay, so it's 6 months of the launching, 1 year of this administration. There's still a lot to be desired. We want to see them actually creating those platforms where they're actually giving us more information about what they are doing, and all of us actually following and helping them to actually push it. Because like I said, once again, the Nigerian patients are worth it.
All right, Alant, we need to let you go now because you need to attend to something quite crucial, and we must let you. You agree with me that we need to bring you back, and we promise you that we're going to have this conversation once again. But we must thank you for your time, taking time out of your busy schedule to attend to us this morning. Dr. Douglas Emeka, we really appreciate your time and your submission on this subject.
Thank you very much, Femi, and Blessing.
Free exchange, shaping policy, advancing development.